Self-direction favors people with independent resources. Much of the cost of services provided through self-direction is borne by individuals or their families. People with disabilities who rely on SSI for their income are among the poorest in the country, likely to fall into the 12% of adults who are unable to pay an unexpected expense.
Homelessness among Albuquerque citizens is one of the main issues facing the city. In many cases, the solutions to homelessness seem geared towards keeping homeless people away from the community rather than finding core reasons factoring into a person's housing situation, such as access to healthcare, work, and resources. As I was not able to work due to the epilepsy, I was unable to pay bills, and those bills included being able to pay rent. Threw me into a dizzy spell of sleeping on people's couches.
In general, housing is difficult to find, and adding specifications such as affordability and accessibility reduces options even further.
I lost my job with IBM. I had to learn how to do everything again. I had to learn how to eat again, walk again, talk again, everything. Yes. So we sold the house and we moved in some apartments and figured it out. And that's what I did.
It's very exhausting trying to get these services for TBI. Exhausting. No, we shouldn't have to know somebody. And there are no community housing projects for people with TBI. We like to think of other states that have housing in a community for individuals with TBI, and they could have a sort of assisted help, on a daily basis if they need it. But those are just pipe dreams at this moment and not able to be realized for housing.
As a professional, I can't in good faith recommend someone for Section 8 housing since the housing isn't available and landlords can refuse to rent to someone using a Section 8 housing voucher.
The only option that I had was to apply for Section 8, but I got kicked to the end of the list. Again, without the connections that I have, I wouldn't live where I do.
There is a crisis in staffing for direct support professionals that work with people with disabilities. There are not enough workers, and those who do the work now face low pay and difficult working conditions.
If it was difficult before COVID-19, it's even more difficult now. Really hard to pay people 24-hour care. So there's not enough money in my Maria budget to be able to do so. So that's why I'm grateful for people like Daniel, Lindsay, and my family.
Person-centered practice is aligning service resources that give people access to the full benefits of community living and ensure they receive services in a way that helps them achieve their individual goals. As long as disability is viewed as a problem to cure or as an incapacity to participate in the labor force, and not tied to rights and justice issues, the potential for individuals with disabilities to accumulate assets and the right to live in the world will be stymied.